Welcome to the morning edition of Newsfeed. That's Newsfeed AM on channel 405. We kick off with another edition of the Health Hub with Bhekisisa's editor-in-chief, Mia Malan, joining us in the studio. Health Hub has tackled some really pressing topics around the coronavirus pandemic. What has the feedback, Mia, been like so far?
Great feedback so far, Hugo. We get about 4 to 5 emails per day or calls from people with feedback from our viewers, and we're of course very grateful for that. And one of the most heartening bits of feedback that we got recently is from a teacher with HIV who decided to get vaccinated after one of our programs. She was vaccine hesitant, wasn't sure if she wanted to get vaccinated, and then she watched the interview about 2 weeks ago with Kanyan Daki, who was also vaccine hesitant, but then shared a story on air about why she did decide to get vaccinated in the end. And after watching that interview, this teacher decided to get vaccinated. And HIV is, of course, a comorbidity. You are far more likely to fall seriously ill with COVID if you have HIV. So we're very grateful that we could have played a small part in that decision.
Fantastic feedback, Mia. Now, SAHPRA has authorised the use of vaccine in a certain age group. Does it suggest that we should just go full throttle with vaccinating that age group?
No, it does not necessarily suggest that, but before we get to that, I wanted to give you another piece of feedback, and that is that after we had an interview with Professor Charles Wasongi from Cochrane, South Africa, we had two very nice things that happened after that. And one of it is that a public sector doctor from the Western Cape got hold of us and said he was assigned to talk about vaccine hesitancy, a series of talks to his staff, and didn't quite know where to start. And then he gave us feedback that he found the Health Hub's recording on YouTube and then listened to that and used the tips that Professor Wasongi gave and also played in clips of the video. And there was a practice in Cape Town, a private health practice, who decided to not see people who had not been vaccinated against COVID. And they then watched Professor Wasongi's interview, in which he explained that it's far more effective to show empathy towards people who are vaccine hesitant rather than to exclude them. And as a result of that interview, they then reversed their decision.
Absolutely amazing that Health Hub is having such a positive impact on the people out there. Now, speaking of navigating the water, so to speak, one of the challenges that government is having is in keeping vaccination figures up.
Yes, we can look at the figures of these past 2 weeks. We saw them surge after we opened up for people between 18 and 34, and then they have gone down slightly again in the past 2 weeks. They were above 250,000. As you can see here, they've gone down to between 200,000 and 225,000. And something the health department is doing to try and address that is to make it really easy to get vaccinated. So to allow people to do walk-ins, to get registered on site, and to also have pop-up sites within communities so that people don't have to travel far to get vaccinated. But that does not seem to be enough at the moment. We now clearly need very well-designed communication campaigns to address vaccine hesitancy.
Now, we've now vaccinated 18% of the population in South Africa, so there's still a long way to go. And one of the challenges is to increase the proportion of fully vaccinated adults, and certainly with the Johnson & Johnson show delivery of vaccines. But on Friday, we heard by Medicines Regulatory approve Pfizer's COVID vaccine for use on teenagers. Would it help the numbers if we opened up the vaccinations for those people? Now, certainly it's something that has been topical. I know a lot of people have been talking about it. We've had a number of interviews on Newzroom Afrika 405 where the question has been, what do we do around vaccination of younger people? So in a moment, we will turn to Mia and she will respond to us, particularly when we take a look at some of the responses that we've had. We talked about Professor Wasongi's interview a week ago in which he's encouraged the vaccination of adults. So today, that is a question on at the table at the moment. So Mia, coming back to that question, Pfizer's COVID vaccine approved on teenagers. Should we go forth and vaccinate all the teenagers?
So yes, SAHPRA has approved this vaccine now for everyone older than 12 in South Africa, and previously it was approved for or authorized for use of people of 18 and older. So many countries have started to vaccinate adolescents or teenagers, for instance, France, Israel, the United States, Canada. And people could now, of course, ask, if we want to vaccinate as many people as possible by December, would it not make sense to open up vaccinations to everyone who's 12 and older? But it's not a simple decision, because we know the older you get, the more vulnerable you get to falling seriously ill with COVID. And that would influence a decision as to when we make vaccinations available for teenagers. But let's talk to the experts. We are joined on the line by Silverani Padayachee. She is the Senior Manager for Pharmaceutical Evaluation at SAHPRA. And we're also going to talk to Dr. Nicholas Crisp, who is currently the Acting Director General in the National Health Department, and he is leading South Africa's COVID vaccination rollout. Welcome to you both. Thank you very much for sharing your time with us and joining us today. Let's start with you, Ms. Padayachee. We now know that Pfizer's vaccine has been authorized for people of 12 and older. What was the exact date of authorization? When did this happen? And do teenagers take the Pfizer vaccine in the same way as adults? Do they also get 2 shots? And do they get those shots in the same quantities or dosages as adults?
Good morning, and thank you for having me over. Yes, the Pfizer vaccine has been then authorized for use for those 12 years and older, and that happened on the 11th of August this year, following submission of information from Pfizer on the safety for these individuals 12 years and older. The dosage would be the same, and the number of vaccinations or doses are the same for both 12 years and older as well as 18 years and older.
Dr. Crisp, we now know that SAHPRA says that Pfizer's vaccine is safe and effective for teenagers. When are we going to start to vaccinate them in South Africa?
Morning, Mia. Morning to the viewers. So I think that the lead-in questions earlier are very important, and that is that the highest risk population is the population we really need to get to now. So we still need to get to another 30% or in some provinces and up to 40% in others of people over the age of 60. That's the primary target, to get older people who are most vulnerable vaccinated. There's no question about that. Clearly, there are people in age groups lower than 60, especially in the 50 pluses, who are also vulnerable. And even in the age group from between 18 and 49, there are a number of people who are vulnerable to vaccinations because of a selected number of comorbidities. So that is very important. But we do know that there are also children between the ages of 12 and 18 who are vulnerable, and we've seen that in the Delta variant spike, wave that we're experiencing at the moment, the children were more affected than in the previous waves. We clearly don't know what will happen in the 4th wave, but we do know that it is coming. So it will be important to protect children. However, what we do need to do is give chance for older population to have greater numbers vaccinated. And when we introduce for the children, we must make sure we have enough vaccine in the country, that we are clear on the protocols. Of course, these are minors, and although minor children may take the decision on their own to be vaccinated, usually parents or guardians will be involved in that process. So it's a different ballgame entirely. So we are not in a position and have not taken a decision at this stage to immediately vaccinate children, but that is something that is very much in discussion at the moment.
Dr. Chris, I know it might be difficult to give a specific time or a timeline as to when this might happen, but there are many parents out there who are very anxious to get their teenagers vaccinated. If you had to give a slight indication, would it be this year? Would it be next year?
Yeah, so I don't want to preempt discussions, because what happens is that a lot of people get consulted in the process. As I said, there are administrative issues about whether there's sufficient vaccine and what we have planned and so forth. There are also adjustments to the administrative system. But more importantly, there's decision-making that involves the clinical practitioners and scientists in the ministerial advisory committees. Then there are presentations to the various government bodies that are involved in the rollout, which may include government departments such as education, social development, and so forth. So I don't want to preempt any of those discussions. We will make recommendations from the Department of Health into the Interministerial Committee, and when a decision is taken there, we will be in a position to announce a date. I do think that it is possible that it would be this year, but I don't want to say conclusively whether, which month or when that might be.
Ms. Padayachee, when it comes to side effects for teenagers when they use Pfizer's vaccine, are there any side effects that they would experience that adults wouldn't experience, or are there some side effects that adults experience but teenagers would experience it more commonly?
So from the information we've got, the side effects are more or less the same. It's basically the pain at injection site, a bit of swelling, fatigue, headache, and that's the same type of side effects that has been experienced also by the younger age group. So there's nothing unusual or more than already experienced by the adults. There are, however, information or signals that indicated myocarditis in younger individuals, especially males, and we are very much aware of this. And regulators worldwide have agreed that this is a very rare side effect, but it's something that we look out to receiving possible reports on that. So our vigilance system on reporting is a mechanism in which we use to get information from the public. So we would urge if individuals who are young, and it could be even people that's 18 years and older, especially males, if they could report if they do feel side effects. And these are basically exhibited through pain in the chest, shortness of breath, and arrhythmias, which is basically irregular heartbeat. So we are fully aware of that, but that's very rare that this actually does occur. So we would urge public to actually do report and contact their healthcare professional as soon as they have these side effects.
Dr. Crisp and Ms. Padayachee, please do stay on the line. When we get back, we're going to talk about vaccinations, other vaccinations that might possibly get approved for the use of teenagers, see if that's possible, and for even younger children. Do stay with us.